Hello, I'm Juan Pablo Frias, Chief Medical Officer and Head of Diabetes at Biomea Fusion. On behalf of all authors, I am pleased to provide a short summary of our poster describing key observations from the dose escalation portion of study COVALENT-111, a phase 1-2 trial assessing the oral covalent Menin inhibitor, BMF-219, in patients with poorly controlled type 2 diabetes. By way of background, the root cause of type 2 diabetes is beta cell dysfunction, which is present at diagnosis and progressively worsens over time. Menin is a scaffold protein which is an important physiologic regulator of glucose metabolism. Suppression of menin, such as during pregnancy, results in enhanced beta cell mass and function. BMF-219 is an oral covalent menin inhibitor under development for the treatment of both type 2 and type 1 diabetes. We have previously reported improved glycemic control with 4 weeks of BMF-219, which persists in over 1/3 of patients for up to 22 weeks after stopping therapy. Here, we present additional key observations of 4 weeks of 50, 100, and 200 milligrams daily BMF-219 in patients with type 2 diabetes poorly controlled with up to 3 anti-diabetic agents. Again, treated for 4 weeks and then followed for an additional 22 weeks after discontinuation of therapy. Across the initial 100 and 200 milligram cohorts, 39% of patients had at least a 0.5% reduction in hemoglobin A1C at week 26. These patients achieving a mean reduction in A1C of 1.3%. In looking at the pharmacokinetic response, there was a dose-dependent response, with the 200 milligram dose taken with food resulting in the highest PK exposure. The hemoglobin A1C response at week 26 across cohorts suggests a durable response after 4 weeks of treatment. Importantly, in looking at the combined 100 milligram and the combined 200 milligram cohorts, 20% of the 100 milligram treated patients had a greater than 1% hemoglobin A1C reduction at week 26, and almost double, 36%, achieved this threshold at week 26 with the 200 milligram dose. None of the placebo-treated patients achieved this greater than 1% threshold. In looking at the combined 100 and 200 milligram cohorts, 26% of patients had a hemoglobin A1C reduction of greater than 1% at week 26, with a mean reduction of 1.5%. The brief patient case illustrated in the poster describes a 61-year-old woman with a 10-year history of type 2 diabetes. She was poorly controlled with a hemoglobin A1C of 7.9%, despite triple agent therapy, metformin, a GLP-1 receptor agonist, and an SGLT2 inhibitor. She was treated with BMF-219, 200 milligrams once daily for 4 weeks. Her hemoglobin A1C progressively declined over the 26 weeks, a 1.1% reduction, and time in range measured by continuous glucose monitoring increased to almost 90%, a 30% increase from baseline. Again, this was with 4 weeks of treatment and over 5 months, or 22 weeks, off of BMF-219. In summary, at week 26, 22 weeks after completing 4 weeks of treatment with BMF-219, patients in study COVALENT-111 are displaying improved glycemic control while off therapy, supporting improved beta cell function. A higher proportion of patients treated with BMF-219 200 milligrams daily achieved a clinically significant reduction in hemoglobin A1C of greater than 1% compared to the 100 milligram dose at week 26. These data demonstrate the novel disease-modifying potential of short-term BMF-219 therapy in patients with type 2 diabetes. In the ongoing next phase of this study, the expansion phase, patients with poorly controlled type 2 diabetes are being treated with up to 12 weeks of once daily BMF-219 and followed for up to 52 weeks. Thank you.